Welcome back to the neurology component of First Aid Reviews brought to you by Falcon Reviews. So what is Parkinson's disease? Parkinson's disease is a neurodegenerative disorder of the central nervous system associated with Lewy bodies, which are intracellular inclusions made up of a protein called alpha-synuclein. Parkinson's disease also involves a loss of dopaminergic neurons, leading to depigmentation of the normally dark substantia nigra pars compacta. Rare cases have been linked to the neurotoxin MPTP, which is a contaminant in some illicit drugs. The cardinal features of Parkinson's disease are captured in the mnemonic TRAP: tremor at rest, often called a pill-rolling tremor, rigidity, akinesia, and postural instability. You can remember this by recalling that Parkinson's disease patients feel as if they are trapped in their body. The circuitry of the basal ganglia help us to understand other movement disorders such as hemiballismus. These patients have a lesion in the subthalamic nucleus causing disinhibition of the thalamus, leading to sudden, wild flailing of the contralateral arm or leg. Such lesions can be seen in patients with lacunar stroke. The name is derived from the fact that the motion itself is half ballistic, as in throwing a baseball. Another disease of the basal ganglia is Huntington's disease. Huntington's disease is an autosomal dominant trinucleotide repeat disorder due to mutation in chromosome 4. The repeat is a CAG motif which shows anticipation. Pathologically, neuronal loss is found in cholinergic and GABAergic neurons in the caudate nuclei. Neurons are thought to be damaged and die via glutamate toxicity via NMDA receptors. Clinically, these patients present with choreiform movements, depression, and progressive dementia. The symptoms typically become first apparent between the ages of 20 and 50. There are several types of abnormal movements that patients can present with, and it's important to keep the terminology straight. For example, chorea refers to sudden, jerky, and purposeless movements. They are characteristic of diseases that involve basal ganglia lesions, for example, Huntington's disease. The term chorea refers to dancing, so think of choral dancing or choreography when thinking about this term. Athetosis refers to slow, writhing movements of the fingers. These are also characteristic of basal ganglia lesions and are seen in Huntington's disease. Think athetose as meaning not fixed or snake-like. Myoclonus refers to sudden, brief muscle contractions, as in muscle jerks or hiccups. And dystonia refers to sustained, involuntary muscle contractions like those seen in writer's cramp. Tremor is a commonly used descriptor, but it's important to keep the different types of tremor straight in your mind. Essential or postural tremor is an action tremor, that is, it worsens when holding a posture, and it's autosomal dominant. Essential tremor patients often self-medicate with alcohol, which will decrease the tremor. You can also use beta blockers for this. Resting tremor is most noticeable distally, and this is seen commonly in Parkinson's disease patients and manifests as a pill-rolling tremor. Intention tremor is a slow zigzag motion that's seen when pointing toward a target. It's associated with cerebellar dysfunction. The cerebral neocortex is separated into 4 lobes: the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe, which each have different functions. For example, within the frontal lobe there are several areas important for motor output, such as the frontal eye fields, Broca's area, the premotor area, and the motor cortex. The parietal lobe houses the principal somatosensory areas. The occipital lobe houses the visual cortex, and the temporal lobe houses auditory areas, such as the primary auditory cortex, which sits on Heschel's gyrus, and Wernicke's area, which is part of the associative auditory cortex. The homunculus. The sensory and motor parts of the cortex are topographically organized, such that areas of the cortex that correspond to adjacent areas of the body are next to each other. The cortical representation of the body is called the homunculus, and this organization can be used to localize a lesion in the cerebral cortex. For example, we know that the leg region of the motor homunculus is served by the anterior cerebral artery. Therefore, we can localize strokes that lead to leg weakness to the anterior cerebral artery. There are quite a few clinical correlations that are worth being familiar with. Here is a list of classical lesion-deficit correlations. For example, the amygdala. Bilateral lesions of the amygdala lead to the Kluver-Bucy syndrome, which involves hyperorality, hypersexuality, and disinhibited behavior. Lesions of the frontal lobe lead to disinhibition and deficits in concentration, orientation, and judgment, and you may see the re-emergence of primitive reflexes. Lesions in the right parietal lobe often cause a spatial neglect syndrome, which is an agnosia of the contralateral side of the world. Lesions of the reticular activating system in the midbrain are known to cause reduced levels of arousal and wakefulness and can cause coma. Lesions of the bilateral mammillary bodies can cause Wernicke-Korsakoff syndrome. The Wernicke syndrome involves confusion, ophthalmoplegia, and ataxia, whereas a Korsakoff syndrome classically involves memory loss, confabulation, and personality changes. Lesions of the basal ganglia may result in tremor at rest, chorea or athetosis. Lesions of the cerebellar hemisphere are known to cause intention tremor, limb ataxia. Damage to the cerebellum results in ipsilateral deficits. Therefore, patients tend to fall towards the side of the lesion. That's because the outflow of the cerebellum via the superior cerebellar peduncle is to the contralateral cortex, which then projects down via the corticospinal tracts back to the ipsilateral side of the lesion. Recall that the cerebellar hemispheres are laterally located, such that lesions of the cerebellar hemispheres cause deficits to the lateral limbs. Lesions of the cerebellar vermis tend to cause truncal ataxia and dysarthria. So recall that the vermis is a centrally located structure and it affects the central portions of the body. Lesions of the subthalamic nucleus are known to cause contralateral hemibolismus. Lesions of the hippocampus will cause anterograde amnesia, which is the inability to make new memories. Lesions of the paramedian pontine reticular formation, or PPRF, will cause the eyes to look away from the side of the lesion. In contrast, lesions to the frontal eye fields will cause the eyes to move toward the lesion. Here are more clinical correlations. Central pontine myelinolysis refers typically to a state when there have been rapid changes in osmolarity, causing rapid shifts in water, for example, in the overly rapid correction of hyponatremia. Loss of myelin in the pons can lead to acute paralysis, dysarthria, dysphagia, diplopia, and loss of consciousness. Recurrent laryngeal nerve injury results in loss of innervation to all laryngeal muscles except the cricothyroid, and this leads to hoarseness. Aphasia. Aphasia refers to an acquired inability to either produce or understand components of language. There are essentially four major types of aphasia that are broken down by whether the deficit is in the production of language, the understanding of language, or the repetition of language. So, for example, Broca's aphasia is a non-fluent aphasia where comprehension is intact. This is due to a lesion in Broca's area found on the inferior frontal gyrus. This can be remembered by the mnemonic Broca's broken boca. Wernicke's aphasia is a fluent aphasia with impaired comprehension. This is due to a lesion in Wernicke's area on the superior temporal gyrus. And the mnemonic for this is that Wernicke's is wordy but makes no sense, or Wernicke's equals what? Global aphasia is a non-fluent aphasia with impaired comprehension, and typically both Broca's and Wernicke's areas are affected. Conduction aphasia involves poor repetition but fluent speech with intact comprehension. And classically, the lesion here is in the arcuate fasciculus, which connects Broca's and Wernicke's areas. Patients with lesions here cannot repeat phrases such as no ifs, ands, or buts. That concludes the second portion of the First Aid Neurology Review, brought to you by Falcon Reviews.